So the concept of frailty syndrome is a concept that has been introduced for many years in the treatment of different hematological malignancies and non-hematological malignancies. And we try to introduce this concept in the setting of allogeneic stem cell transplantation. Once again, I want to mention the fact that age is not an absolute exclusion criteria for allogeneic stem cell transplantation, and that in addition to age, we have to take into consideration some other clinical characteristics of the patients that are related to the associated comorbidities, and also some physical characteristics of the patients. We have performed within the Spanish group for stem cell transplant and cellular therapy different retrospective analysis looking at patients that are candidates for an allogeneic stem cell transplant and patients that are candidates for an autologous stem cell transplantation, where we demonstrate that the population of frail patients have a worse outcome than those patients that are included in the elderly population of patients but don't fulfill these frailty criteria. This happens both in the allogeneic stem cell transplantation setting, but also in the autologous stem cell transplantation setting. And in addition to that, the other aspect that we wanted to analyze was the possibility to modify this frailty concept with some prehabilitation before the allogeneic stem cell transplantation, demonstrating that the long-term outcome of those frail patients that had received a prehabilitation program before allogeneic stem cell transplantation was significantly improved with respect to the long-term outcome of the frail population of patients that were not included in the prehabilitation program. Basically, the conclusion of this concept is that frailty index should be included in the decision-making process of potential candidates for a stem cell transplant, both autologous and allogeneic stem cell transplantation. And second, that the implementation of prehabilitation program could eventually increase the population of patients that are candidates for a stem cell transplantation.